Hi, my name is Zara Kadir and I'm a counsellor and psychotherapist specialising in art and play therapy with children. And today I'm going to tell you a little bit about how art and play therapy works, because it can be a bit of a minefield and a bit of a mystery. Children process emotions very differently to adults. For example, if I'd had a really bad day, I could go to my friend and say, "Oh my goodness, I had the worst day. It's just one thing after another of bad things, and it all became so overwhelming, and I just lost it. I had a breakdown in the middle of Sainsbury's and everybody thought I was mad." And my friend might say, "Oh my God, that's awful, and how bad for you, and are you okay, and is there anything I can do?" And I'd feel relieved because somebody had heard my experience and had validated my experience. And I also had the cognitive and emotional understanding to know that the series of difficult things I'd experienced had led to this big overwhelm, and that's what led me to have my meltdown in Sainsbury's. For children, it's not so simple. They don't understand that domino effect of experiences that leads to them being overwhelmed, and actually it takes a lot less for them to be overwhelmed. If they wake up in a bad mood and they just start the day badly, they don't really understand why the same way we do. So they wouldn't be able to go and tell somebody, "I've had a really bad day because of these things." So when they come to play therapy, they might do this through play. The child might get dolls or puppets. They might play teachers. And I've seen that quite often with puppets and with playing with chalkboards, where a child will play the teacher and they'll give me an impossible to solve equation. And through that, I can reflect to them how that might feel. And I can say to them, "Oh my goodness, this maths equation is impossible. I feel so silly that I can't do it, and I feel really frustrated that I don't know what my teacher's asking me to do." And through that reflection, they can start to internalise what I'm saying. So they might, on some level, recognise, "I feel frustrated. I feel silly because I don't know what to do." And they get that same catharsis and that same release that we get as adults from explaining our experiences, but they get it through role play. So I use things like puppets, I use things like dressing up, I use sand tray therapy, small world play like dolls' houses and lots of different figures, and of course art materials like painting and crafting and pretty much every art and craft material that you can imagine. For some children, one of the most effective parts of therapy is actually having somebody in the same place at the same time that never asks anything of them. For example, a child that's had lots and lots of ruptures to their attachment figures. So by that I mean if they've been moved from one home to another, or if they've been moved schools lots of times, or if they've struggled to attach to their primary caregivers because they were adopted or fostered, or they've experienced a feeling of rejection from having lots and lots of siblings at a very young age, I can be that person that's just always there for them and doesn't ask anything of them. For children with things like ADHD and autism spectrum disorder, they can come here and they can do whatever they want. They can make as much mess as they want. They can start something and not finish it. And that freedom to be themselves is very, very therapeutic. If you find it useful and you'd like to know a little bit more, then you can find me on my website, www.choose-therapy.co.uk, or of course you can find me on the counselling directory, Zara Kadir.